You've been hearing me talk a lot about tests. So people are asking me, what are some of these tests? In fact, what is the most important test to have done to determine my risk for heart attack and stroke? It actually is a test looking for coronary artery disease, for heart artery disease. This picture is a picture of looking for subclinical disease, meaning we have your heart on the left side of the page and an arrow pointing towards the heart and the heart arteries. These arteries, blood vessels, give the blood supply with the nutrients and the oxygen that the heart muscle needs in order to work properly. If there's a problem in one of these arteries, that's when a heart attack occurs. So it's real important for us to understand, first of all, what is a healthy artery? What's a diseased artery? And what can we do about it anyway? Why would we want to know? Perhaps you have had a friend or you've heard of a celebrity in the news or even a loved one who felt fine this morning and was in the hospital with a heart attack this afternoon, or felt fine this morning and then called you and said, I'm on the way to the hospital, I'm having chest pain. How can that happen? How can chest pain or shortness of breath or even a heart attack be someone's first indication that they have coronary artery disease or vascular disease, atherosclerosis, risk of heart attack? Well, it's because we haven't traditionally in the healthcare community looked for subclinical disease. Not that we want to go looking for a problem just to be able to say, yes, you've got a problem, but because if we find it, then it's really important to understand what does the disease process look like, and we can look again in a year or 2 years or 3 years and make sure that our efforts for you are improving the health of your arteries. This is what the arteries look like if we were to, rather than look at them horizontally or vertically, from the outside looking in, if we were to perform a cross section, if you will, and look down the arteries as though we were looking in a pipe. On the left side, you'll see that the artery wall looks incredibly healthy. There's no obstruction of blood flow, and there's no even small or large developments of plaque in the wall of the artery. So we want to know early on if you're starting to develop a little bit of plaque or a lot of plaque, and certainly if there's blockage of blood flow. So when we look at this picture of the heart and the heart arteries, we want to know, okay, this looks fine if we're doing some test to look at the heart from the outside looking in, but remember that cross section of looking down the pipe? We want to look inside the left main coronary artery, inside the circumflex coronary artery, inside the left anterior descending artery and the right coronary artery to see if there's early stage disease, subclinical disease before your first symptom. So in order to do that, we have technology now by Cleerly Health, artificial intelligence, which has allowed us to enlarge the inside lining of the heart arteries to a large degree where we can actually see them with the naked eye, whereas before they were so tiny, it was hard to really understand what was going on with a crisp, clear picture. So as you can see at the bottom, there's that familiar looking coronary artery tree, the coronary artery blood supply to the heart muscle. And then on the left, those 4 vertical lines are the 4 arteries we're talking about, these branches of the left main coronary artery that are giving the blood supply, and of the right coronary artery that are giving the blood supply to the heart itself. So we can lay those out straight and apply this technology to the arteries to determine, is there any plaque? And if so, what does the plaque look like? So we want those artery walls to be incredibly smooth. We want to see no evidence of plaque, but if we do see plaque, then the next question is, how much plaque and what type of plaque? And yes, we want to know if it's blocking the flow of blood. Believe it or not, that's not the most important information that we need to know. Certainly want to know if it's blocking the flow of blood, but we want to know a lot of things about the plaque before it ever blocks the flow of blood. And that's how we can save your life and keep you from developing a heart attack down the road. So this is one of those coronary arteries or heart arteries enlarged again. And the gray pipe down the middle of the page is the blood flow. But that thin yellow line going up and down each side of the artery wall is outlining what's called the vessel wall intima. That's the very inner lining of the blood vessel where plaque would begin to develop if it's accumulating in the wall of the artery. And so if we see plaque, it's those yellow, in this particular patient's case, it's the yellow areas of plaque that we see along the right side and a little bit the left side of that upper area of the artery wall. And when we see the yellow, we know that this type of plaque is not completely stable, and it's not the most dangerous kind of plaque, but it is what we call non-calcified plaque, and it's a moderate risk kind of plaque. So not all plaque is the same. We need to understand, is this a dangerous lesion or is this a stable lesion or somewhere in between? These 5 different sections of pictures are, again, our cross section, as though we're looking down the artery like it were a pipe, to determine the type of plaque. So on the left side of the screen, where the plaque is red and described as a necrotic core, that's the type of plaque on the wall of the artery that reminds me of a raw egg yolk that can easily rupture, and that can lead to incredible, devastating problems. To contrast that with the far right side of the page, where the plaque shows up as blue, that's a completely stable plaque lesion. So if I see someone and they have some red plaque, if you will, my goal is by the time we look again, I want it to be completely blue. And if it isn't completely blue, then I would love to at least see that plaque moving in the direction of blue, moving in the direction of stabilizing. And then you'll see green and yellow in between the most dangerous kind of plaque, the necrotic core, the egg yolk type plaque, or the blue plaque, which is the calcified, the stable plaque, the scar tissue type plaque. So when you get your CT scan, your Cleerly evaluation, you want your plaque to move towards blue and be green or yellow or blue. And if you see red, then we're definitely going to get busy in changing things really quickly. So transforming plaque, as you'll see at the bottom of the page, is the only trackable approach to personalizing heart attack prevention. So think about it. Until this technology was available, so many of us in the healthcare world, and you as a healthcare consumer, were analyzing and treating really risk factors. We were treating your risk of heart attack, your risk of disease. We weren't actually able to understand, well, does this person have the disease? And if so, what does it look like? Is it stable or not? And can we improve upon the disease process? So this technology has markedly improved our prevention efforts. This is how we can know, this is how you can know if you're headed for a heart attack or not, is to get a CT angiogram with Cleerly Health Artificial Intelligence. And you can call my office for information. Click the link below to learn more about this test. This is a test that I recommend for everyone over age 45. And actually, Gina Pritchard's opinion is everyone age 40 and over should have this test because heart attacks are so incredibly common.